PRP or platelet-rich plasma versus stem cell injections or Wharton's jelly. I've used both. I've watched both play out across thousands of patients, and I have one clear answer. The industry does not want me to say it this plainly, but here it is. You've been doing your homework. You've read that stem cells regenerate tissue. You've read that PRP helps healing. You've seen the price difference. And now you're sitting there with two options and a lot of conflicting information and no one willing to just tell you which one to get. That paralysis is exactly what this video is going to fix. After 25 years treating foot and ankle conditions and more than 25,000 procedures, I've prescribed both of these treatments. I know what each one of them does when it works, and I know what each one does when it fails. And after all that, I have a very specific position on which one wins for most foot and ankle patients. It probably cuts against what you've been told to expect because the more expensive option is not always the better one. I'm going to walk you through what each treatment actually does, where each one breaks down in real patients. Then I'm going to give you the verdict and tell you exactly what to do with it. The case for stem cell injections. The pitch for stem cell injections is genuinely compelling. You take cells that have the ability to transform into tissue, inject them into damaged areas, and let the body rebuild from the inside. For someone dealing with a tendon that won't heal, a joint that keeps flaring, or plantar fascia that has been inflamed for a year, the idea of actually regrowing healthy tissue sounds like the answer. Stem cell therapy spreads fast because it's promised something that no prior injection could offer. Steroids, mask pain. PRP signals your body to heal. Stem cells, in theory, provide the raw material for the body to grow new, healthy tissue from scratch. That is a categorically different promise, and patients started seeking it out aggressively. Practices that offered it filled up. The demand outpaced the science. Here is where the clinical picture gets complicated. The term stem cell injection has been a marketing language. A large portion of what gets sold as a stem cell injection in the foot and ankle care contains no living cells at all. These are often processed amniotic products or other biologics that may carry growth factors and signaling proteins, but have had the actual cells killed off during processing. What the patient receives and what the patient believes they are frequently receiving are two different things. Most people paying a premium for stem cell injections are buying a product with no stem cells in it. So let's look at PRP with the same level of honesty because it has real failures too, and knowing these failures is what makes the verdict defensible. The case for PRP. PRP is your own blood, processed down to concentrate of platelets and growth factors, then injected into the area that needs to heal. The appeal is that you're not introducing a foreign product. You're amplifying your own biology and telling the body to do more of what it already knows how to do. For patients with plantar fasciitis, tendon pain, or soft tissue injuries that have stalled in their healing, this is a compelling mechanism. PRP gains serious traction because the science behind it is real and the mechanism is trackable. Platelets release growth factors. Growth factors stimulate tissue repair. Concentrate the platelets and you amplify the healing signal. It started in professional sports medicine and spread into the clinical practice as evidence-based built. Patients started requesting it by name. PRP fails when it's done wrong, and it gets done wrong constantly. The quality of PRP injection depends on how the blood is processed, how the concentration is achieved, where exactly the injection is placed, and whether the protocol around the support of healing response is triggered. A poorly prepared PRP injection delivered to the wrong location by a provider who learned the technique at a weekend course is not the same product as PRP prepared and delivered by someone who has done it for thousands of times. The failure rate for PRP across the industry is inflated by low quality delivery, not by a flaw in the biology. PRP has a reputation problem and it belongs to bad technique, not the treatment itself. So if PRP's failure traced back to the execution rather than the mechanism, and stem cell injections often contain no actual stem cells, the real question becomes, what is the actual variable that determines which of these treatments produces the best result? What I actually found after years of watching both of these play out is simple. The name on the label does not actually tell you what's actually in the syringe, and what is in the syringe is the only thing that matters. Let me give you the diagnostic that maps your situation onto the right answer. The real variable most people ignore. At this point, you know stem cell injections are often mislabeled and that PRP quality varies enormously. You are still looking for a decision, and now you need to know what actually applies to your situation. Questions. How long have you had this pain? Has it been going on for more than 6 months without meaningful improvement? Have you already had a steroid shot for this? Did it help you briefly then stop working? Has anyone told you the tissue itself is degenerated, not just inflamed, meaning the fibers of the tendon or fascia have started to break down rather than swell? Are you being offered stem cell product at a significantly higher price point than PRP with every clinical explanation of what that product actually contains? Do you have access to a provider who has done PRP injections hundreds of times and used imaging guidance to place the injection precisely? Here's how to read your answers. If your pain has been going on for months and nothing has worked, you need something that actually restarts the healing process. Both PRP and stem cell injections are supposed to do that. That is the whole category. The problem is one of them delivers on the promise consistently and one of them usually does not. If a practice cannot tell you exactly what is in their stem cells, you are being sold a name. PRP uses your own blood. You know exactly what you're getting every single time. The only variable is whether the provider knows how to prepare it and where to put it. This is a solvable problem. Figuring out whether a stem cell product from an unfamiliar practice is legitimate is a much more difficult ask. Here is the verdict. Real quick, if you find these videos useful, please subscribe. Every week I break down foot and ankle conditions and treatment options in plain language so you can make a smarter decision before you end up in the wrong office getting the wrong treatment. The verdict. For the overwhelming majority of foot and ankle patients being presented with this choice, high quality PRP from a provider who knows what they're doing wins. The biology is sound, the delivery is verifiable, the product is your own blood, so there is no variability in the process, and when it's done correctly, it produces consistent results across plantar fascia, tendon injuries, and soft tissue problems. Verified amniotic stem cell products from reputable sources have a legitimate role in specific cases, and I use them in my practice, but that product and what most practices are calling a stem cell injection are usually not the same thing. Across the regenerative medicine cases I have treated, the patient who got poor results from stem cell injections almost always received a product that could not demonstrate actual cellular activity. The patient who got poor results from PRP almost always had it delivered imprecisely and without the surrounding protocol to support healing. When I control execution quality, PRP produces reliable, repeatable results. The stem cell market is much too variable in product quality for me to recommend it broadly without knowing exactly what that patient is being given. If you choose a stem cell injection from a practice that cannot clearly explain what is in their product and what their product contains, you're spending more money for a less reliable outcome. If you walk past PRP because you believe something called a stem cell injection is automatically superior, you are making a decision based on marketing rather than biology. The wrong choice here means more months without relief and more money spent chasing a result that a well-executed PRP series could have delivered. The most expensive injection is not always the most effective one. Here's exactly what to do tonight with the information I've given you. How to act on all this information. Here is your next move. Do not book a regenerative injection appointment until you ask one specific question. Can you tell me exactly what is in this product and what it contains, and whether it has been verified biologically for the activity that it does, and how can you confirm injection placement? A practice with a legitimate product and a skilled provider can answer the questions clearly. If the answer is vague, that is your answer. Stop comparing options by price or by name. Stop letting the word stem cell function as a quality signal. The name is not the product. If you are currently in pain and have already tried conservative care, contact a foot and ankle specialist who uses imaging guidance for regenerative injections and ask specifically about their PRP protocol and what amniotic products they carry. Ask them to explain the difference. A provider who can explain it clearly has done the work. A provider who defaults to marketing language has not. If you are currently being treated with a stem cell product that has not produced results after a reasonable trial period, the conversation to have with your provider is this: can you tell me specifically what is in this injection and how we assess whether it's worked? And what does the next step look like if it hasn't? You came into this with two options and no clear winner. PRP, done correctly by someone who has done it extensively, is the more reliable choice for most foot and ankle presentations. The stem cell label by itself means nothing. If you want to understand why most practitioners still default to the injection that comes before any of this, watch the video next below. It is called After 25 Years Treating Heel Pain, I Can't Recommend Steroid Shots Anymore. It will make everything in this video land harder.